look inside our control room where it's all done. When it comes to surgery, a new study finds that bigger hospitals aren't always better. For the first time, Consumers Union, the publisher of Consumer Reports, rated nearly 2,500 hospitals in all 50 states. Well, it turns out many nationally renowned hospitals earned only mediocre ratings. Dr. Kavita Patel is senior fellow at the Brookings Institution and an internist at Johns Hopkins Hospital. Doctor, welcome. Good to see you.
Thank you for having me.
So what does this study tell us?
So the study looked at two particular areas around surgical safety, and one was around the number of deaths involved while a patient or after a patient has surgery, and the second was how long a patient might be in the hospital that is longer than expected.
And I think this turns conventional wisdom on its head, right?
It does, in the sense that we've always thought about some of the rankings of hospitals, and we think that sometimes bigger must be better. And this just shows us that if you're getting one of these 5 procedures that they looked at, including what former President Bush just had, which was one of the procedures they looked at, that you should have a conversation with your surgeon and think about the hospital you're going to.
And why would a smaller hospital be better for a stent, for instance?
It's a great question. So one thing we do know about with surgery is that the quality control as well as the experience of the surgeon matters. In some of these smaller hospitals, they've initiated quality improvement measures to actually make sure they decrease infection rates and improve outcomes, and they've recruited surgeons who actually have a great deal of experience in doing these procedures.
And if they're fairly common procedures, they've got the experience too, right?
Exactly.
You call this study groundbreaking, principally because we just don't have a lot of information about hospitals, right?
That's right. This is the first time in a series of studies that we've had publicly available reporting on hospital safety. And it wasn't just surgery. They've also looked at other areas such as acquired infections and how many other problems people can have in a hospital setting. And before, if you looked even 2 years ago, we didn't have anything. If you Googled this, we found nothing. And now we have rankings.
Why is that? Why isn't there more information?
The data, it's complicated. You know, the quick answer is it's complicated. The more detailed answer is that if you look at think about any time you've had to go to a hospital, there's so many aspects to what makes that successful work, not complicated, a better experience. And putting all that together and then putting a ranking or a number to that can be very difficult to do. But for surgeries, this was a great insight into something that if you're getting one of these 5 procedures, it's worth you looking and talking about with your surgeon.
I think this is huge as a consumer to have this information, because if you're going to have an elective procedure, as you point out, you can now go online, take a look, and find what is going to be the better hospital to get this done. Absolutely. I know you're pro-information in terms of empowering consumers.
Absolutely. And there will be a day soon where you can look up my name as a doctor and look up my ratings and how safe what I do is for a patient.
And those ratings will be done not only by patients, but
they'll be done by patients, by the hospitals themselves, insurance companies, states are doing it. You'll see it all around.
All right, Dr. Kavita Patel,
Great
to see you.